Self-care.
Care for yourself.
You care for yourself. You owe it to yourself to care for yourself.
Yes, so. But in case you don't know, there is such a thing as International Self-Care Day. So, if you did not care for yourself, what's today's date? Today is 25.
25, yes.
If you did not care for yourself yesterday,
start today.
Do it now.
It's never too late to start.
I guess one of the things that we can say about the Self-Care Day, International Self-Care Day, is to call attention to self.
Yeah.
Not in a selfish manner, but at least to let you know that if you don't take care of yourself will take care of itself. By landing you in hospital, and I don't think that is what anybody will.
You know what they say in in flight operations? They said ensure your own safety before you ensure safety of anybody else. Like if you if you're not, that's it.
It's like you're shooting.
It's like it. And then for practically for life really, if you're not fit and healthy, if you don't take care of you, how can you take care of anybody else? If you're in that line where you have people dependents to take care of. If you're not healthy, if you don't engage in self-care and ensure, then because if something happens to you, who will take care of them? Really?
Well, just by way of definition.
Yeah.
Self-care is this is not, I don't know whether this is the official definition, but maybe our doctor will also help us this morning. Dr. Ramon Moronkola is a consultant interventional cardiologist.
Wow.
He's with us in the studio this morning. Thank you for joining us today.
But let's have that definition.
Sorry?
The definition you
Yes, I'm going to ask him.
Okay, right.
Please.
Thank you for having me. Good morning, viewers.
Self-care is the intentional practice of preserving and improving your own health, well-being, and happiness. Yes or no?
Yes. So we talk about intentional acts, practical approach, daily choices we make, all aimed at ensuring that we protect our health, improve our health, and prevent disease. So I guess in the past, when we say health, the individual is totally dependent on the healthcare provider, that's the hospital and the doctors and the nurses, to define and take care of your health. That's in the past. But what we are saying is, as an individual, you should take proactive steps. The choices we make every day, we can't be in the hospital every day, but the choices we make every day define what happens to your health. So if you are conscious of that, that's what's called self-help. So those activities you engage or you avoid aiming at protecting your health or improving your health, that's actually called self-care.
I know you will take us to those later, but maybe if you can do a wild guess. I think the thing you are saying is, first of all, this whole conversation starts with awareness.
Yeah,
exactly.
Good. If you would take a wild guess, using Lagos, for example, circa 20 million people, as we say, 22 million people. Nigeria is a lot more, we hear. But if you take a wild guess, what percentage of Lagosians are aware of this need for self-care?
I'm sure we'll be talking about less than 5%.
What?
Yeah.
Even despite all this fit farm.
So when we see people go to the gym, for example, people talk about, there are different reasons people do it. Some for wrong reasons. Because you mentioned the use of gym. People just think going to gym will make you just to build muscles, to appear healthy and look fit. Sometimes those activities are not done properly, not well guided, because exercise is something that has to be prescribed too. Exercise is to be prescribed. You can't just say, they say exercise is fine, it's good, and you jump to the street and start running on the treadmill or start running on the street. There are conditions where the amount of exercise you're allowed to do will be prescribed. So, for example, you have some heart condition. Do you understand? Sometimes there's some kind of exercise you can do that can put some pressure on your joints, can be detrimental over time. So if you are talking about self-care, that man that is running a treadmill, does he even know his blood pressure? Does he know his heart condition? You understand? So as world advanced technology, also there's some advancement in technology, there are lots of options we can explore now, and that's why the issue of awareness is important. And that's part of what we are doing now. So for example, there are opportunities now to check your blood pressure at home. In the past, most times, the only time you get to check your blood pressure is when you get to the hospital, which can't be every time. Maybe we have another reason to go to the hospital.
And even at that time, it wasn't everybody that knew how to take your blood pressure.
Oh, exactly. Remember that machine you have to pump and it's complex. But now, technology has, we have advancement in technology. We have machines now that you can own in your house. Just for you to be trained, I'm sure even centers where you buy a machine, you can train you how to use the machine. It provided is a validated machine. You can check your blood pressure. And you know that you can not just check your blood pressure, you can track your blood pressure over time. That is very, very important.
Okay, there's something that you have said, and I'd like you to expatiate a little further on it. The fact that exercises need to be prescribed.
Exactly.
Facebook is not helping matters.
Yeah.
You have to choose your own healthcare provider.
Facebook is not helping matters. You see Tai Chi exercise, Tai Chi walking, Tai Chi this one, Tai Chi that one. You see, you want to lose belly fat.
Asian Pilates.
You want to lose belly fat. You take this, mix this fruit with this fruit, blend it, take it 2 times a day or something, and all those things. So, how do people go about this? I need you to emphasize the need for prescribed exercises, so that I have been in an environment before. My fitness coach was telling me he had a guest. They just started with this guy. He looked very fit, and the guy collapsed.
Yes.
He looked fit, as in there was nothing wrong with this guy. The guy collapsed. What happened? The guy was just doing warm up, and he collapsed. So I need you to explain further about the need for not just exercising, but prescribed exercising, and why they need to be for prescription.
So Savi, I think we need to try and distill it and categorize into 2 reasons why you want to exercise. Some want to exercise just for fitness, especially if you are into sports. Do you understand? So you're a footballer, you are into sports. You know, the reason for exercising is not just for health reason, it's for professionalism.
Yeah.
So there's something that in that instance, that's your job. But I tell people, if exercise is always safe, footballers will not be collapsing on the pitch and dying. There are people that play football, that's their profession, they are fit, yet sometimes they are playing football. During the match, they fall, some have cardiac arrest. That tells you that there's a limit to what the heart can take sometimes. There are people that, for example, most of them have myocardial infarction is sometimes exertion induced. Do you understand what I'm saying? So if you are seeing a doctor that's analyzed, that's assessed you, he will prescribe, he will tell you the amount of exercise. So generally, we don't advocate for extreme exertion. We say brisk walking, 30 to 45 minutes, just like 4 times a week is fine. I have lots of patients that I have to tell, you don't need this amount of walking. Are you planning to go for Olympics? You are 55, you are 60, you say you can walk for 3 hours. You have to define the reason you are doing these things. Do you understand? So exercise has to prescribe. If you go to physiotherapy, if you see a physiotherapist, while he's seeing you, most times he will usually want you to see a doctor first to know your state of your heart. If you don't know your state of your heart, that is why I gave you an example of you are jumping on a treadmill, you are running to the gym, you don't even know your blood pressure. That's why it went, because that's hypertension is a major driver of cardiovascular disease worldwide. We say cardiovascular disease is the commonest cause of death worldwide. More than 70 million deaths worldwide. Hypertension is a major cause. Heart attack, stroke, kidney disease is a major cause. So if you don't even now know where you belong regarding your status regarding hypertension, how do you now know even if you develop other higher level of cardiovascular disease, which can put the individual at a risk of developing complications during exercise. There was a research that we did some years back, and we looked at hypertensives, healthy looking hypertensives. If you have any documented maybe kidney disease, documented complaints that looks like you have heart failure, we excluded all of them. And we said, okay, let's do an echo. That means echo is like a scan. We scan the heart and measure the size of the heart, the thickness of the wall. We found out that more than 50% of them already has some kind of effect of hypertension on the heart. These are healthy looking individuals. So that means if you don't check, you won't know. So if before you can engage in exercise, it's important that you do a clearance, get a clearance from a doctor, and they tell you, oh, based on what we're saying, please limit the kind of exercise. We encourage people, we encourage mobility, move around, be active, those have positive effect on cardiovascular disease. However, I've not seen where extreme exercise has additional benefit. Oh my gosh.
Well, it weakened me yesterday. It knocked my 2 legs off.
And in fact, reality is I keep telling you.
I wasn't exercising because I wanted to. So I'm just putting that out there. But so don't worry, Jockey, I know you have your own questions too, but just to help anyone, there is the challenge of not over-exercising.
Yeah.
There's also the fear of asphyxiation. I have related with someone before who a doctor told her, Madam, you are exercising too much. This person wasn't exercising up to me and I'm older. And the doctor said that this fellow was exercising too much and that the person should take it easy. The person is no longer exercising because the doctor said. So help us find balance.
Well, I'm trying to figure out the reason the doctor would tell the individual to exercise.
No, they checked. I think some muscles were what do you call it? Breaking somehow.
So that's a special case.
Yeah.
Okay.
That's a special case. I don't know exactly what it is. For sometimes, in fact, for people that have joints problem, sometimes there are different forms of exercise. There's weight-bearing exercise. There's non-weight-bearing exercise. So sometimes weight-bearing exercise may be dangerous for some. So that may be the distinction where they tell you, please do something. Some will encourage cycling, maybe stationary cycling, other forms of exercise. So that's why I said it's better to prescribe. At no point will we tell anybody not to exercise. Yes, because sometimes you can exercise lying down. We need some, for cardiovascular wise, for example, for the health of your heart and your lungs.
You must move.
It's good to move. Raise the heart a little bit. Increase your respiratory rate. You understand? It expands the lung. It gives a good feeling. So I think it's good, but the only thing is we must find balance, and by balance is must moderate. Most times you see your healthcare professional to guide you.
Right.
You understand? That's the most important.
You could also be a fitness coach to guide.
Yeah.
Yes, but we have fitness coach. Fitness coach will not be able to assess your cardiovascular health.
Yeah.
You won't know. They may say that you want to check blood pressure, but I'll tell you, there are different ways of checking blood pressure. And if it's not properly checked, all you get from it is anxiety.
Yeah.
There are 3 things. We are talking about the machine. Is it the right machine that is being used? Is it a clinically validated machine? Is the cuff appropriate for your size? If you are big, for example, you can't use a small cuff to check your blood pressure. It will overestimate your blood pressure. So if your hand is too big for the cuff, your blood pressure will appear higher than what it actually is. What will happen? You'll be anxious.
Yeah.
And you can falsely now prescribe medication for you, which will make you feel worse. So the machine, which includes the machine itself and the cuff. Then the patient, the individual who's checking blood pressure, there's something about positioning. You understand the timing?
Yes.
You must empty your bladder. All those things very important.
It's like this is for me. Sometimes they say that you have to put the machine at the same level as your heart before you can take a measure.
The cuff should be at the same level as your heart.
Okay. So like here.
At least it should be.
Okay.
You understand?
Okay.
So when I try to domesticate it for my patients and explain to them, use your dining table.
Okay.
Dining table, you likely have the best chair to use. It's a chair where you can sit, back up to the head, rested. That means there's a rest for the back, before the back and the head. So you are rested.
Yeah.
The hand is on the table, you're rested. So there's no power in the hand. You're not suspending your hand. The hand is rested on the table, relaxed. Then the machine is applied. When that is done, then you wait 5 minutes.
Before you take the
5 minutes.
What about those who use phones to measure blood pressure?
Well, no, I can't categorically condemn it, because I'm sure there was a time we were not sure of these digital machines we're using now.
Yeah.
Technology has shown, researches has shown that they are effective. Well, technology is still advancing, but we don't recommend the use of phone now. Maybe in future. We will get there.
When is the future? Is the future?
The future is not here yet. I told you we were somewhere before. Remember that time we used to do this pumping of the so at that point, at that stage, exactly. So at that time, we were saying, we're not sure of these digital machines are coming up, but we've seen they are validated. There are institutions that are engaged in validation of those devices now, and they've done some validation. In Nigeria, we have validator machines in Nigeria that can be used. So if you're using a validator machine, you know that you are getting a reliable result. But if you rely on your phone, I'm not sure. I've not seen literature support that for now.
Right, and as we're talking about self-care, it's good to talk about these issues, because one of the major issues that we neglect is, as you have said it, is the heart. And you never know. You just believe that you're A-okay, and then one day you just check and say, oh, this was wrong with me. I didn't know. And I think a lot of things that we do, all centers on the heart. At the end of the day, you're anxious, you're happy, you're sad, everything comes back to.
Yeah.
So, what are the hidden dangers of treating self-care as an occasional emergency? Oh, I'm not feeling this one, so you quickly do it, and then you feel better. But as opposed to making it a habit, a daily routine of self-care. You wake up, you ensure you're okay, you do this, you take time, you sleep well, you do this, even at work, there's a tendency to overwork. But then again, you don't work for yourself. For those who don't work for themselves, like you work in private companies, there are deadlines to meet, and your working hours are probably not sufficient to meet those deadlines. So you overdo it, you get back home, you still have obligations. So, how do you balance it all? And you still, putting your self-care routine as a daily ritual, not occasional.
So the reality is that we should view health as a journey or as a tool and not a destination. Nobody can say I have attained health or healthy status, because there's so many dimensions to health. Just like you said, cardiovascular disease is one of the commonest cause of death worldwide. Hypertension is a major driver. That's why it seems like we talk about it every time. There are other aspects of it. Just like you said, having good sleep helps your heart function well, helps your brain function well. If you don't sleep well over a long time, things will start going wrong. You start hearing things that's not there. You start saying things that is possible. So just something as having a good sleep is important. So just like you said, instead of waiting for the day you feel something in your heart, like I saw somebody yesterday, we were discussing, and he said, every evening I notice that my heart rate goes up. I said, how did you know? He said, I just feel it. Then when I go to check my blood pressure will be high. At that time I know that my blood pressure is always high. You don't wait until you feel something to check your blood pressure. So blood pressure is dynamic. It's affected by activities. It's also affected by state of mind. So if you're happy, you're anxious. Whether you're happy, you are sad, you are angry, you understand? Your blood pressure will be high at that time. And it is appropriate for your blood pressure to be high. Just like I was describing earlier, that when you put your hand, you wait 5 minutes before you start measuring. The reason is because you have to calm down. Do you understand? To get a rested blood pressure. When you come to sit, as you are sitting for a while, your blood pressure will assume your rested blood pressure. If there's any reason for you to stand up, blood pressure will go up. If you start walking, it will go higher. You run, it will go higher. So as you're coming to sit on the table, the blood pressure is higher. You have to wait for it to settle, calm, before you can check the blood pressure.
You didn't mention the fact that sometimes when you are watching horror film, your blood pressure could also be high.
Definitely.
And watching football with your team playing.
As far as your team is, there's one team I'm taking. No, sorry. I won't mention the name.
So those I'm just trying to emphasize what you said about
exactly. Those conditions, don't check your blood pressure at that time, because it will give you a false blood pressure. The only thing you are going to get is what? Anxiety, unnecessary anxiety. Oh, my blood pressure is high. Meanwhile, it is nothing. It's just your blood pressure is only responding to the situation, which is appropriate. I'll tell you, if your blood pressure does not rise with activity, it is a disease on its own. If you stand, you start moving, walking fast, your blood pressure is not tracking it and following you. It's not going high. The individual will collapse. Because the more activity you exert, the heart needs to pump faster.
It's like
you need more blood to go to the brain. The brain needs more blood. Because during activity, muscle will consume will require a lot of blood. So as you're walking, lots of blood will go to the muscles. If you don't pump extra to accommodate that and also supply the brain, what will happen is the brain will now be deprived of blood and start feeling dizzy and collapse.
The last one, why do we have pregnancy-induced blood pressures?
It's an entity.
I'm just wondering why
it's a complex situation. There's so many factors involved.
Explain.
Could that be because the child is also having blood pressure and they are combined?
The child doesn't have any problem. It's just that pregnancy. So the pregnancy-induced hypertension itself is a risk factor.
Yeah,
on its own. So there's so many factors that can be involved, but either ways, you can't place your hand on one particular thing causing it. Do you understand?
Yeah.
So it's also an important fact. It points to the fact that checking your blood pressure regularly, whether pregnant or not pregnant, is also important. If you pick it early, the risk of complication reduces.
Right.
So in any situation, whether young or old. So when we are talking about trying to marry the complex schedule and staying healthy, what you've been doing over time, you get accustomed to it. It's just like when you tell somebody, can you reduce salt in your food? A man that is used to adding extra salt on the table, you find it difficult initially. However, if he decides that I will stop adding salt on the table, after some time you get used to it. Then you say, okay, can I start reducing the salt used in cooking? They start gradually. So something you have to get used to.
So essentially, self-care is a journey.
Yeah,
exactly. It's a continuous. There's no point you say, okay, I've achieved it.
There are so many angles to this, Dr. Moronkola, that I'm pretty sure that we're going to have to we'll have you over another time to discuss, because we have not even talked about the nutritional dimension of self-care.
Important.
We'll get to it some other time. Dr. Ramon Moronkola is a consultant interventional cardiologist. Thank you so much for your time.
Thank you.
I appreciate it.
Thank you.
Okay. There's a particular medicine that people are also advised to take. It is called medicine. It's called laughter. We'll talk about that a bit when we return.